recognize the member for Nepean.
Thank you, Madam Speaker. It is Nurses Week, and as a nurse, I want to share a little bit about what it's like to be a nurse in Ontario today. Right now, you get to work, you pay ever-increasing parking fees, you wonder if you're going into your shift fully staffed. Chances are you're not. You get there, you work through your 12-hour shift, and then you're mandated to stay an extra 4 hours to 16, because once again, you're too short. You're burnt out, you're frustrated. We as nurses all just want to do what we came there to do. It is provide quality and compassionate care to our patients. But in this current system, we are unable to do that. Premier, nurses don't need more slogans. They need respect, fair wages, and safe working conditions. We don't like to be called heroes and then you slap us with Bill 124 and freeze our wage increase annually during a pandemic. Premier, will you finally listen to Ontario's nurses and commit today to investing in nurse retention and guaranteeing safe staffing levels in our hospitals and communities?
I want to remind the members, ask your questions through the Speaker. Response, I recognize the Minister of Health.
Thank you, Speaker. So I'm not sure if the member opposite is aware of an upskilling program that has actually trained over 1,000 nurses to be able to work in their emergency departments, in their local hospitals, in their communities. Have they spoken, and do they talk to the nurses who have been able to benefit through over 400 nurses from 72 rural and remote hospitals who have received upskilling training? That's the investments that we make in people to ensure that individuals who are practicing in perhaps one department want to work in ICU, in emergency department. When we invest in our people, we are investing in our communities. And we have seen a very high interest and uptake in individual RNs who are taking advantage and using those opportunities to upskill and ultimately serve better their communities. We will continue to invest in people. We will absolutely continue to invest in capital. But at the end of the day, this is about ensuring individuals have opportunities to train, work, and stay in their community.
Back to the member for Nepean.
Thank you, Madam Speaker. And with respect to the minister, nurses aren't buying it. You're saying that you're investing in us and you're investing in people, but we live the real lives on the front lines in the hospitals and in the communities, and that is just not what's going on. If this government were truly making historic investments, we wouldn't have hospitals relying on agency nurses at double the cost. We wouldn't see ERs in rural and urban communities alike closing because they don't have staff. And we wouldn't have thousands of nurses leaving the profession telling us that they feel disrespected, unsafe, and unheard, especially from this government. Minister, you can't fix a healthcare staffing crisis with press release.
I'd like to remind the member, you ask your questions, direct them through the Speaker.
Sorry, through you, Speaker, you can't fix a healthcare staffing crisis with press releases or slogans. We fix this by listening to nurses, by giving them wages, working conditions, and respect they've been pleading for. So, Speaker, through you to the Minister of Health, will this government finally act, not with more spin, but to ensure safe nurse-to-patient ratios and make public health care a place where nurses want to stay?
Back to the Minister of Health.
Speaker, I certainly understand that the member opposite is new and perhaps doesn't understand the history of the Liberal government where they actually cut medical seats. It is important to understand by cutting medical seats, you have actually ensured that fewer people...
The Liberal Party will come to order.
...to medical training in the province of Ontario. Allow me to quote Doris Greenspun from the RNAO. You may know her. She commends the government's intention to accelerate the integration of internationally trained nurses as one of the urgent actions required to address nursing. Ontario's hospitals appreciate the province's continued commitment to building a strong healthcare workforce, which will help ensure patients continue to receive high-quality care close to home. That came from the President and CEO of the Ontario Hospital Association. You know, stakeholders, understand
Response.
that the commitments that we have made, that the investments that we are making, the expansions that we have done lead to more people being able to practice in their communities and offering those opportunities to young people.
Question. I recognize the member.